You're turning 65. Do you have to take Medicare? It is the number one question I get. Let's talk about 3 common situations. First, let's say you have insurance through the marketplace. You could be working or not working, but bottom line is that you don't have insurance through work. Under that scenario, you are going to want to sign up for Medicare Part A and Medicare Part B. If you try to stay on your plan and then later sign up for Medicare, you will potentially have penalties for Medicare Part B and Medicare Part D. Now, there is an exception to this rule for those of you who maybe do not qualify for Medicare Part A premium free, but as a general rule, you're going to be going on to Medicare. The next fact pattern. You are working and you work at a company with 20 or more employees and you have insurance through the plan. You do, your spouse does, whoever it is. In that scenario, you do not have to enroll in Medicare at 65. You have a choice. So what I say to people is make a comparison. Look at your plan, compare it to Medicare's pricing and costs and coverage, and then make a decision. So if you stay on your plan and then you later enroll in Medicare when you retire, you'll have what's called the special enrollment period, and you will not have a penalty for not taking B or D when you first turn 65. Now, let's talk about a third pattern. You are working and you work at a company, there's 19 or less employees, and you do have group coverage through your plan. If you stayed on your plan and then you later enrolled in Medicare a couple of years later, you would not have a penalty. You're still going to have what's called a special enrollment period. But there's a problem with this scenario. If you are at a company with 19 or less employees with this type of insurance, your insurance is not primary to Medicare, it is secondary. So if you stay on this plan and you end up having a very serious health issue, it's possible the insurance company could do an audit, could look at, the costs and realize that, wait, you should have been on Medicare because your plan is secondary to Medicare. So unless your employer or the insurance plan is going to give you in writing a guarantee that they're going to remain as the primary payer, you should be getting onto Medicare Part A and Medicare Part B. Now, what you can do is you can consider keeping that plan as a secondary payer, but typically that's a very expensive proposition. So the bottom line is people do worry about this because they want to enroll timely. So keep in mind which of those 3 fact patterns you fall in, and know that if you are not taking your Social Security by the time you're approaching 65, they're not going to be knocking on your door telling you to sign up. So you really need to focus in realizing these are decisions, choices that you're going to need to make.